Did you know that the cure to one of the deadliest cancers might be encoded in our genome? Hepatocellular carcinoma is the most common primary liver cancer, which often metastasizes to the lungs. This makes finding a cure challenging and is the reason why the survival rate for patients 5 years after diagnosis is a shocking 21% with current treatment. Thankfully, the work of some amazing researchers in 2010 has led to the discovery of using gene therapy to treat this disease with a promising success rate. If you're interested in learning all about how gene therapy can be used to treat cancer, you've come to the right place. Welcome to the genetic basis of stuff and things. Gene therapy has enabled scientists around the world to modify DNA and RNA in ways that can benefit individuals or entire species with lethal mutations or undesirable traits. Decades of research and development have led to the important discovery of the use of nucleic acid-based therapy to treat diseases such as hepatocellular carcinoma. Nucleic acid-based therapies are treatments that use a nucleic acid, such as DNA or RNA, as their therapeutically active component. Chemotherapy and radiotherapy are regarded as the classic and currently the most effective forms of cancer treatment. Unlike the classic techniques, gene therapy aims at restoring the function and expression of the affected genes without killing entire cells with highly proliferative abilities. You might be wondering, if we know that the mutated p53 gene is the issue and that gene therapy can fix mutations, why don't we have a cure? And well, the answer is quite complex, so stick around to find out more. The p53 gene is the human tumor suppressing gene, found in the short arm of chromosome 17, which plays a crucial role in the cellular response to DNA damaging agents. The protein encoded by the p53 gene is involved in cell cycle control, DNA repair, apoptosis, and cell differentiation. Hence, the destruction of this gene can be lethal to the cell's survival. Missense mutations of the p53 gene are believed to be what causes hepatocellular carcinoma. These somatic mutations can either lead to loss of function or promote oncogenic activities, including metastasis. This knowledge triggered the development of the first anti-tumor gene product, Gendicine. Gendicine was the first commercially approved gene therapy product which uses a recombinant adenoviral p53 gene to help lessen the prognosis of some cancer types. Gendicine was initially used to treat head and neck squamous cell carcinoma, but soon found many other useful applications, including the treatment of ovarian, bladder, liver, and lung cancers. Hepatocellular carcinoma is particularly difficult to treat due to patients often developing metastasis, a condition where the cancer cells break away from their origin and relocate to a new location in the body. The discovery of this transmission method within hepatocellular carcinoma patients urged scientists globally to research and develop a cure to the cancer that has over 600,000 cases of mortality worldwide each year. A study performed in 2010 explored the safety, efficacy, and administration method of using the recombinant adenovirus p53 gene to treat hepatocellular carcinoma. Over the course of 12 months, 20 patients diagnosed with pulmonary metastasis caused from hepatocellular carcinoma were treated using Gendicine. This treatment caused the recombinant adenoviral p53 gene to highly effectively treat patients with minimal invasiveness. Minimally invasive treatment was achieved through transcatheter arterial chemoembolization in combination with bronchial intraarterial injection for all 20 patients. In addition, if the size of the metastatic tumor was greater than 3 centimeters, intratumoral injections of Gendicine were administered to increase the treatment efficacy. 13 of the 20 patients received this treatment at the site of the metastatic tumor. After the 12-month trial period, clinical symptoms were alleviated in 16 patients and exacerbated in 2 patients. Additionally, 2 patients were lost to follow-up. Furthermore, the lung tumors disappeared in 4 patients and the tumor size decreased in 6 patients, remained unchanged in 5 patients, and increased in 3 patients. This works out at an approximate 80% success rate for lessening the prognosis for hepatocellular carcinoma patients. The outcome of this study proved as a glimmer of hope in the development of a cure for this lethal disease, which is currently the 3rd most common cause of cancer-related death worldwide. Not only is the outcome of this treatment method more successful, but it has far fewer adverse effects compared to the current alternatives. Pneumothorax occurred in 2 patients but was treated with no other complications. The most common adverse effect was a self-limited fever between 38 and 39.5 degrees Celsius, which was found in 16 patients. As previously described, nucleic acid-based therapies are the way of medicine into the future, with many studies showing breakthroughs. Although there is still a lot of research and development around the use of these techniques to treat patients with life-threatening diseases. The future is bright for the treatment of hepatocellular carcinoma.